Welcome to the Mount Pleasant podcast, featuring discussions and interviews about the people, places, and events that make Mount Pleasant such a special place.
This is the Mount Pleasant podcast. I'm your host, Brian Cleary, and all thanks to the great people of Mount Pleasant Magazine, I get the honor, the privilege of introducing you to Mount Pleasant, the people who make it such a special place to do business, to work, and even to live. We're introducing you to Mount Pleasant's best on the Mount Pleasant podcast. We all want to look good and feel better. That's pretty much a universal quality for all of us. How can we get there? Well, sometimes it's true we need a little help, and perhaps that's help that we're offering today here on the Mount Pleasant podcast. I'm Brian Cleary, and today I'm joined with Dr. Craig Blum. Dr. Blum is with Sweetgrass Plastic Surgery. Dr. Blum, I think when a lot of people hear the words plastic surgery, and maybe I'm dating myself a little here, but you go back to the time when that was just for Hollywood actors and actresses who were getting facelifts or breasts enlarged. Plastic surgery is way more than that today, isn't it?
Oh, absolutely. And I think there are a lot of misconceptions, as you were mentioning. And there's pretty much a plastic surgery treatment for everyone at any level, at any age, just whenever someone wants to improve their appearance. And then there's always a starting point. You
guys offer what your website calls a comprehensive lifelong approach to confidence and beauty. So let's talk a little bit about Sweetgrass. What is it that makes you guys a little bit different?
Well, I think the comprehensive is the word that you used, and I believe that sums it up. And that old saying, when all you have is a hammer, everything looks like a nail. And so whenever you have a bunch of tools in your tool belt, then you can treat each person individually, as opposed to having the patient align with the treatment that you or have available, then you adjust the treatment for the patient. And I think that's key. I think to have all those options at your disposal, and then you're giving someone the right treatment, not just the treatment that you have available.
So let's talk about you yourself, doctor. You're a double board certified plastic surgeon. What are your areas of expertise?
Yeah, so dating myself too, it was whenever I was going through training, that was really the only way to do plastic surgery, is to build a foundation. And so I started in general surgery right here in Charleston, MUSC, and then moved to New Orleans to do plastic surgery at Tulane. And then, Dr. Schimpf, who started Sweetgrass, and I were friends at MUSC, and then called him up one day and we started talking, and he felt like I would be helpful here. And so I came back and joined him, and it's been great.
Tell me what you think is the biggest misconception that people may have right now about plastic surgery.
The best plastic surgery is surgery that no one knows that you had done. Basically you look like you, just a refreshed version of you. And sometimes when I say these things during consults, it almost sounds like you're coming off like an infomercial, patients will say, oh, you look more rested, have you been on vacation and things like that. I think that's a sign of very good plastic surgery when you don't recognize someone's had plastic surgery. So one of the misconceptions, I think, is that people have this kind of overdone, windblown look, and don't look anything like themselves, and almost become like a caricature. And that's not it at all.
Now, plastic surgery, I think everybody automatically thinks, oh, it's for women, but that's not the case, right? Somebody like me, maybe I need some plastic surgery, or that could be a benefit for me.
Oh, absolutely. And I think that after the pandemic, when a lot of people were working from home and they were doing things like this, they were on Zoom and web, and people see themselves and they see their face and they're like, gosh, I look tired, or, I have these bags under my eyes and my eyelids look heavy, and, my double chin looks full and things like that. So, I think that, obviously the surgeries are different because people want to address different needs, but, there's something for everyone. And, the gynecomastia, so male breast enlargement, that's incredibly common, much more common than people would think, but just no one talks about it, but that's something that we see all the time. And it's can make a big impact on someone's life and, just their confidence. And those are things that have kind of surprised me when guys talk about, they have to choose what material shirt they're going to wear on the boat. That much thinking goes into it. You would think that, that guys wouldn't care as much about that sort of thing, but they care just as much, if not more so, about their personal appearance in many situations like that.
Something that you and I share, I think. We all want to look good. We all want to feel better. Sometimes we need a little help in getting there, and that's what we're trying to provide today on the Mount Pleasant podcast. This is where the pages of Mount Pleasant magazine come alive. I'm Brian Cleary, joined by Dr. Craig Blum, who is with Sweetgrass Plastic Surgery. Dr. Blum, what would you say is the procedure you do the most popular one?
I'd say it's going to be either liposuction or tummy tucks are very common, and that's mostly all of plastic surgery. I think you have a core set of surgeries that you do very well, and board certified plastic surgeons are very well trained to do those things. And so liposuction, various areas of the body, and tummy tuck, breast lift, breast augmentations. Generally speaking, plastic surgery of the body, at least falls into two primary categories, where it's either what's the primary problem. So you're trying to figure out if the primary problem is fat, then liposuction and different liposuction types are a great treatment for that. If the primary problem is skin, then liposuction doesn't do very much for loose skin, and you're trying to figure out how you can either tighten that skin or remove excess skin.
So would that be the first step in the process when I came to Sweetgrass Plastic Surgery? Let's say I know I got a gut on myself, so I'm thinking that a tummy tuck will help out. The first step that I need to take then is to what?
Well, so I think that's the importance of seeing someone and especially as a team, like you mentioned before, if I feel like a person's going to be better served with a minimally invasive modality and that fits better into your life, understanding this stuff doesn't happen in a vacuum. So maybe this treatment's the best treatment for you, but that doesn't really work with your life and your lifestyle and things. So then we adjust that. And so that's why I think it's somewhat difficult to have a one size fits all approach, but no two people are the same. That's one of the things I love about plastic surgery, is that you don't ever treat a problem the exact same way. So to answer your question, I'm maybe a bit analytical about this, and probably goes back to being general surgery days, is you identify the problem. And so you say, okay, well, what's the problem? And then what's the treatment for the problem? What's the solution for the problem? Well, the things that are causing you to be unhappy with your belly, it's either going to be excess fat or excess skin. And so you look and see which is the bigger problem. So if it's a bigger problem with fat, then what are the treatments that are going to primarily address the fat? If it's someone who's lost 100 pounds and their primary problem is now skin, then you move the conversation toward addressing the skin and tightening skin.
If you read this newspaper, you'll know everything that's going on IOP.
Hi, we're Alec and Marianne Chalmers. We love the vibe. It's great personalized and curated content for the island here. It's a great read. Thank you.
Island Vibes is awesome, and I love that it's a different perspective on the island, and the quality of the paper is super. Thank you.
And positive. Thank you very much.
Island Vibes is a deal.
So, Dr. Blum, I think it's a positive to hear you say that, because I think in some people's heads, and maybe in my mind, I would sit down across from you and the first thing you would say would be, okay, well, we got to open you up. We got to do surgery. You're saying that one of the positive advantages with Sweetgrass Plastic Surgery is the fact that you do offer many alternatives. So as you and I are sitting down for that first consult and I'm across the desk for you, what do you see from a patient that might be a universal or maybe the biggest concern that people have when they're talking with you?
Everybody has a different approach to the consults. And, the way I like to do it is how I would like someone to treat me. And so let's just have a conversation and talk about, number one, what's the primary problem? What are the ways that I can treat that? And you say, okay, well, there are multiple different treatments. Well, which one fits best into my lifestyle? You have a young woman who has a 3-month-old. Her treatment plan's not going to look like, a woman, a middle-aged woman, a career woman who doesn't have younger children. And so I think that's the balancing act, is trying to figure out what is the right treatment, but also what fits into your lifestyle and what's appropriate for you.
Are folks scared to come to see you? I think like on a normal basis, folks go to the doctor and sometimes they're a little apprehensive, to say the least. Do you find that same apprehension when folks come into your office?
I do. And I think that it just makes me consider the fact that some people have this issue that they're very insecure about. And so, I think patients don't realize that it's asking a lot of someone. You're basically asking them to to demonstrate or show you their biggest insecurity, and so I know in my mind, I see this all the time, and I feel like everyone's their own worst critic. And so they may have a concern, and you don't want to minimize their concern, but they may have an issue that they think is, I've heard the words disgusting, and, I can't look at this and things. And you don't feel that way. You don't want to minimize it, but you say, hey, I recognize this problem that you have, but you're asking a lot of them to show you their biggest insecurity. And so I think you have to get over that hurdle. Like, look, I'm here to evaluate this problem with you. There's no judgment. And then what's interesting is oftentimes the things in plastic surgery that we're treating, like we talked about tummy tuck, those surgeries are done when a person has made a lot of positive steps in their life. And so normally tummy tucks are when someone's lost a significant amount of weight. With gynecomastia surgery, it's generally when a guy's starting to work out more. And so they're in the gym and now they're noticing these things. You're noticing the loose skin. And, and I've said this on so many patients before, there is no exercise for loose skin. And so when someone if they have a little hangover, a little loose skin in their belly, that's actually a good thing because you've done all the hard work. And then I feel like that's my opportunity to step in and do my part, because at that point you've done everything that you can do. There is no way to take care of that excess skin, but be proud of what you've accomplished. And then people, even though they have done all this work, they still can't really enjoy it because they see the skin that was a constant reminder of where I used to be, right? And you see that a lot in massive weight loss patients. So they lose the weight, they've put in the work, they've changed their life, and now they have this issue. And in my mind, that's a good problem to have because I can help you with that. So.
Absolutely. And so I would never have thought about it that way. So it's great that you bring it to life here for us. Dr. Craig Blum is our guest. He's with Sweetgrass Plastic Surgery. And here in the Low Country, he is a double board certified plastic surgeon. And I'm Brian Cleary today on the Mount Pleasant podcast. Dr. Blum, if we can get to know you a little bit, normally at this point in time, I'd ask you Carolina or Clemson, but obviously a USC graduate. I think we know which way you're leaning there.
Yeah. So definitely Carolina. My wife's family, they're all Clemson fans. My brother-in-law I think he's on the board. He's diehard Clemson. So it's just my father-in-law and myself. We're the Carolina standouts. So.
You grow up here in the Low Country area, or just in South Carolina, or where?
I grew up in a small town called Mullen, South Carolina. So it was, we would always say near Myrtle Beach because that was the closest point of reference for anybody. And you'd go into Florence to go shopping. And so, I grew up in small town South Carolina, went to high school at Mullins High School, went undergraduate school at Carolina, and then moved to Charleston to go to medical school and then general surgery at MUSC.
So what was it that took you down to the bayou down to Louisiana for your residency and stuff? Did you specifically pick that reason, that school or that area?
Well, I thought Tulane was a great program, and then just a change of scenery. I think that the MUSC has a great plastic surgery program, but you've been in MUSC for a long time. It's nice to kind of change scenery. And then if you're planning to come back to Charleston, then you hope you can go somewhere else and get some information from there and bring back something unique to this area. So
now you mentioned the fact that for 6 years you were doing general surgery as part of that. Had you not gone plastic surgery, did you have somewhere else in your mind where your career would have taken you?
Well, I did general surgery as a path to plastic surgery. And so there was never any intention of doing general surgery. That was just the way that it was. And currently there are abbreviated pathways. I mean, you can go and you do, 3 years of this and then 3 years of that. But at the time, the South Carolina Student Loan Association was like, when are you going to be done? Now, you've been good in school forever. Like, when are you going to start giving us our money back? And so the training took forever. And, a lot of the people that I had gone to med school with, they were done. They had their real careers, and I've still got a book bag going to school. And so, but that was just the way that I felt was the best way to approach it at that time, just because you have a better foundation. There's quite a bit of overlap in general surgery and plastics. And I think the fact that you were a chief resident in general surgery and you did trauma and you took care of patients in the ICU, I think that gives you some perspective, and you can identify when a patient is well or when they're sick, and you can manage them accordingly.
So, Dr. Blum, I have to ask you, because so many people's vision of maybe you as a plastic surgeon has been molded by what they see on TV and in the movies. How much of that is really accurate, or is that just a lot of, the nip and tuck fantasy kind of stuff? What is your daily routine more like?
It makes me think about whenever when I was in residency, and people don't know this, but residents don't make very much money for the amount of hours that they work. And, when you're working 100 and some hours a week. And I remember vividly my very first annual salary, general surgery, was like $37,000, and you're working, 100 and some hours a week. But then you're perceived as the rich doctor, and it's just like, I remember walking past my car because it was 10 years old, because I was thinking, if someone sees me in this car, they're going to be like, surely this guy's not a real doctor. There's no way, there's no possible way. So I think that the reality, and then, sort of what's dramatized, they're very different. I'm not just saying this. I'm very, I'm honored that people would take the responsibility of taking care of someone very seriously. And, you had a lot of options and people that you could have chosen, and you chose me. And I take that very seriously. And I don't take that for granted. And so, growing up in small town South Carolina, middle class family, my dad was the factory worker, my mom was a plant nurse, and so you recognize that money doesn't grow on trees. And so I'm not going to recommend a treatment for someone that is expensive that I don't think is going to be beneficial. I think that in my mind, it's trying to gain someone's trust. So you have a patient for life, so you can play the short game where you say, hey, I recommend this treatment for you. And then they have an expensive treatment that doesn't really do anything, but now you've lost your credibility, and you've lost the patient's trust. I would rather say, and going back to what we were talking about earlier, if let's say the best option for someone doesn't fit into either their budget or their lifestyle right then you say, well, here's an alternative, and here would be the pros and the cons and the expectations for the result and the recovery, and you decide what someone, what fits best into their life. But I will never recommend something for someone that is not going to be of benefit. I would just not offer that, because it's you lose your credibility and you lose the patient's trust, and I can't. I would not want someone to recommend to me or to my wife something where I spend my money and I don't see a benefit.
Let me take this one step farther, and this will be a little difficult because obviously every single patient is different, but if you can give just a general idea. So let's say I came to you and I said, face, neck, and lift. I'm saggy here, like you had mentioned, and we're going to do that procedure. Can you tell me what that would take in terms of, okay, I come to your office that day, we decide on that. The actual procedure, are we talking, 10 minutes, 8 hours? Can you give us a little idea of what a procedure might look like?
Yeah, so we have our own operating room facilities. We have our own anesthesia staff. We have our own recovery staff and nursing staff. So I think that's another misconception, that people think you're going to go to the hospital, and it's a fully accredited OR, but it's in-house, and we have total control over that. And so the patients come in. And that moment, you're the only patient, you're the priority, you're the focus of everyone. And so they're in the recovery area. We go in and talk. We kind of mark things up, confirm the plan. We go to surgery, and generally speaking, the surgeries are a couple of hours, something like that. But that's the time that you go into the OR and then you go to sleep. And then it's a little different too than general surgery. You don't go to a recovery room and sit in a bed queasy for 2 hours, and they get you dressed in your pajamas on the OR table after they put the dressings on. You get transferred to a wheelchair. And then the type of anesthesia that we use is a bit different. It's not the traditional hospital anesthesia where you're hooked to a breathing machine. This machine's breathing for you. These procedures, you're breathing on your own. It's not like you're looking around like this kind of twilight. I mean, you're completely asleep. You don't feel any pain. You're not aware of anything, but you're able to breathe on your own, which makes it much better tolerated by patients. And then when they wake up, they don't have the same queasiness. You go into a recovery area. let you get your bearings and bring out some Gatorade and some goldfish, and then bring a family member back and go over post-op instructions. And usually people are ready to leave the building within an hour.
What is it that excites you? You go into the office every day. This is something you've been doing for a while. What is it that still keeps you passionate about what it is that you're doing?
I think it kind of goes back to one of the things I was saying earlier, is when you're doing something for someone that they can't do for themselves. And that's part of the thing that attracted me to surgery as well. And it's hard to say these things without sound like you're disparaging a different profession, but it really wasn't in my nature to prescribe a medicine and then wait 6 months to see if it works. Maybe it works, maybe it doesn't. Surgery allows you to make an immediate effect on someone. And so those were some of the surgeries that I liked the most: tummy tucks and breast lifts and things where you don't have to look and say, well, maybe I can see something, maybe a little bit. I mean, it's a dramatic change that you can see from across the room. And so those are the things that excite me. When you have a patient that has this issue, you can address it. You're well trained to do it. You've done it hundreds and hundreds of times. And you deliver a quality product, and, their patients come in and they're very happy with it. And so to me, that works. That I love to see patients happy. It's almost, I'm more excited for them than they are, just because I feel like that I've gotten them where they wanted to be.
Well, I guess you could be selfish in that way, because we talk about feeling good, feeling better about yourself. If you're the person that's making that happen for somebody in a selfish way, you've got to feel good about that. What about the patients themselves? Are people surprised sometimes when they are done with their procedure?
The other thing that I guess lose sight of is that patients generally, for the most part, and patients are intelligent. I'm not trying to say that they're not. It's just that you generally don't know much about an area that you're not an expert in. Like I don't know the first thing about the housing market, or how to fly a plane, or any of these things, but I know about surgery. And so I've had patients come in and get a quote, and they literally have no idea, is this going to be is it going to be $50,000? This is what they talk about in New York and LA. It's $50,000 facelifts, this $60,000 abdominoplasty. And so often, I think that's the other part about a consult, is that this is very attainable for people. And, their financing options, there are all these things. And so that goes back to your initial point, is this is just for the rich and famous? And absolutely not. I mean, it's much more attainable than I think people would think. And I think that's one thing that surprises people, is like, okay, actually, this is a realistic opportunity for me. This is something I felt self-conscious about for years. And this is something that I can actually do. I never thought that it was in the realm of possibility, but it actually is.
Sweetgrass Plastic Surgery and Spa. Dr. Blum, you've mentioned the fact that you're obviously a part of what is a team, and you've got a pretty amazing team around you there, wouldn't you say?
Absolutely. Yeah. And then that's the nice thing about having both services, that you can collaborate. And so one of my favorite mentors would always say that the skin that you leave behind is no better than the skin you took away. And so when he was saying that, he was talking about facelifts specifically. And so when someone comes in, and it's not just about loose skin of the face. It's so much more complex than that. Fat isn't all bad. An attractive face tends to be like an upside down triangle, where people have more volume in the cheeks, and it narrows as it goes down here. And so that's plastic surgery's come a long way, where we're understanding these things better. That it's not just about eliminating fat. It's about changing basically the dynamics, and keeping volume where volume is good, and getting rid of volume where volume is bad. And so the other thing is, you're not stopping time when you're removing skin. And so the signs of facial aging, volume loss, the loss of elastin, the loss of collagen. And so you can lift the skin up, but to try to make sure that result lasts longer, you need to make the skin better somehow. And so that's where these other treatments come in, the microneedling treatments, laser treatments, chemical peels, these skincare things. Many times people have live in the low country, and you're out in the sun all the time, and you don't take care of your skin. I never took care of my skin. I was a lifeguard, and I worshiped the sun, and it took its toll on my skin. And so then you realize that, okay, I need to do better about this. And so someone's going to come in and they're going to have this facelift, but now they want to maintain that result. And so that's where you start. You say, oh, I've had the facelift. Now I'm going to have this treatment, and then I'll have this treatment. And just to kind of continue to maintain the results, because you can't stop time, but you can make your skin better and make it more resistant to the effects of time.
You sure? You can't say it's not just a quick and easy.
It put me out of business. Yeah. So if you find it out, just keep it to yourself. So
it's a comprehensive, lifelong approach to both confidence and beauty that's offered there at Sweetgrass Plastic Surgery and Spa. Go on their website, get all of the information, all of the services. There's a lot that they offer, different locations, and he is a double board certified plastic surgeon, one of the best in the Low Country. Dr. Craig Blum, thanks so much for spending time with us today. Really appreciate it.
Yeah, man. Thank you so much. Thanks for having me. I appreciate it.
It's where the pages of Mount Pleasant Magazine come alive. Thanks so much for joining me today, Brian Cleary, here with Dr. Craig Blum on the Mount Pleasant Podcast.
Thanks for spending your time with the Mount Pleasant Podcast, your community, your podcast. Listen to past and future episodes at mountpleasantpodcast.com.